Everyone. Thank you for joining us for Bringing Health Science Foundations to Life Tools for Engaged Learning. It's 1 o'clock p.m., so let's go ahead and get started. My name is Emily, and I will be your moderator for today's presentation. For those of you who are not familiar with us, Realityworks creates hands-on educational tools and programs designed to help students build real-world hard and soft skills they'll use throughout their lives. We partner with schools across the country to make learning more engaging, practical, and impactful. Presenting today, we have another Emily, Emily Kuhn. She is our Senior Campaign Specialist here at Realityworks. She has been with us for over 10 years and works closely with educators and administrators to see how our products and programs are being implemented in classrooms nationwide. Emily is a frequent presenter at conferences, webinars, and professional development sessions, sharing her expertise on soft skills and student engagement. Before we dive in, I do want to cover a quick few notes. First, today's presentation is being recorded, and everybody will receive a link to that recording. Also, everyone will receive a link to a certificate of completion for attending today's presentation, along with all of the resources that Emily will be going over. So keep an eye out on your email for that one. With that being said, I'm going to go ahead and pass things over to Emily to get us going.
Why, thanks, Em. It is the Emily Show today, indeed. And thanks, everyone, for joining us today. We're excited to dive into some great tools for teaching foundational health science skills. That said, let's take a quick look at what we're going to be covering today. So we're actually going to start with just a quick look at the needs of today's students and why building such a strong foundation in health science skills is more important than ever. From there, we're going to dive right into those hands-on tools. We offer a variety of resources designed specifically to bring those health science foundational skills to life. So I'm going to show you the tools. I'm going to highlight the included curriculum that comes with each one, including those ready-to-use lessons, activities, and assessments that are available. And then we'll wrap with some implementation tips, plus a few free resources that you can use right away. So with that, let's dive in. So first, let's take a moment to talk about who today's students are, because understanding them helps us better connect with them. So Generation Z, most of the students in today's classrooms are part of Generation Z. That's anyone born between 1997 and 2012. So these students range from middle school students to young professionals. I always like to think of this generation in terms of my own kids. The youngest Gen Z is about 12, which is the same as my oldest child. And just like him, this generation is the first to grow up entirely in the digital age. These guys are digital natives. They've always had access to smartphones, social media, and high-speed internet. And because of that, their brains are wired a little differently. They expect information quickly, and they navigate tech intuitively. I see this every day with my son. One really encouraging fact that I think is pretty cool is that Gen Z is actually more likely than earlier generations to finish high school and go on to college. So the students you're working with are really a highly motivated group. They just learn a little differently than previous generations. So let's talk about that. How does Gen Z learn? These students are incredibly comfortable navigating digital environments, which means they tend to process information super fast and they gravitate toward visual and interactive content. Of course, this comfort with technology also means they've been conditioned to expect immediacy. They want immediate access to information, they expect instant feedback, they expect those fast interactions, and that shapes how they approach learning. Traditional lectures and slow feedback can feel frustrating and disengaging to them. Now, it is important to note that these students are not necessarily struggling with short attention spans. Rather, you as the teacher are competing with a constant stream of content. So to truly connect with them, lessons need to feel relevant and experiential. I love this chart. This is a quick look at how learning preferences have evolved across generations. And what really stands out to me is in that Gen Z column, the last one on the right, is their learning styles. They want that, they have that get it now, do it now, learn it now mindset, right? So again, they're looking for fast access to information. They're looking for hands-on experiences, and they're looking for real-time feedback. And that's a really big shift from previous generations who are more comfortable with delayed results or more passive learning. So again, for educators, this highlights the need to move from telling to experiencing. And that's exactly why hands-on training tools like the ones we're exploring today can be so powerful. So before we dive into tools and strategies for teaching these skills, let's quickly define what we mean when we say foundational health science skills. So when we talk about these skills, we're talking about a blend of both hard skills, like calculating medical math equations, and soft skills, like communication and teamwork. Together, those skills help students grasp critical concepts like health maintenance, safety, and employability, things every healthcare professional needs to understand. And whether students are heading into nursing, patient care, emergency medical services, any other healthcare path, building these foundations early helps ensure they're prepared not just technically, but professionally. So now let's dive into those foundational health science tools. These are hands-on resources that you can use to bring those hard and soft skills to life. So we're going to start with our medical terminology class kit. This is a great way to bring to life a topic that can sometimes feel, let's be honest, a little dry or often overwhelming for students. This kit makes word building interactive and hands-on. It includes color-coded blocks that represent prefixes, suffixes, root words, and connecting vowels. With just one set, your students can actually build over 800 real medical terms, and more importantly, they can understand how those terms are constructed. Each kit includes 20 student glossaries that follow the included curriculum. Students can use those glossaries to create their own personalized medical terminology dictionaries. These are great for study, reference throughout the course, and then your students can keep those and take them with them to reference later in life as well. The curriculum is very cool. It's fully built out online with 17 ready-to-use lessons. It starts by teaching basic word parts, then moves into terminology organized by body systems. We tried really hard to make it easy to align all of this with your existing course structure, so you'll see those lessons build on each other. And in fact, let's take a closer look. So these are all 17 lessons that are included in the medical terminology class kit curriculum. So like I just said, the first few lessons focus on those building blocks, those prefixes, suffixes, and root words, so students get a solid foundation. And then from there, the lessons are organized by body system. So hopefully students are starting to recognize patterns, like how certain root words relate to specific parts of the body, for instance. These lessons and the order and the structure are all designed to help students break down complex terms with more confidence and to make those real world connections as they go, to help them see the relevancy of the topics you're studying. So this kit does include a variety of assessments. Some are knowledge-based quizzes, others are practice-based skill demonstrations. We did this to keep things engaging and comprehensive for your students. So how would you use this in your class? Well, there are a few easy ways to bring the medical terminology class kit into your classroom. You can use it as part of a standalone medical terminology course. You can integrate it into units on specific body systems, maybe revisiting the lessons throughout the year to just help reinforce learning through repetition. You could break students into small groups and introduce a little friendly competition to keep things fun and engaging. You could suggest challenges like who can build the most medical terms in 10 minutes or who can define the most terms correctly using their glossary. There are all sorts of fun ways to incorporate this kit into your curriculum, and we did that intentionally. We want to make sure that this can be applied to your topics as easily as possible. So like that kit, our medical math training kit is very similar. This is another comprehensive kit that includes student workbooks for hands-on practice, plus lessons and a guide to guide students through the topics, plus an interactive online presentation. So like the kit we just talked about, our medical math training kit is designed to build confidence from the ground up. The curriculum starts with essential skills like fractions, decimals, and percentages, and then advances to critical healthcare applications like medicine dosage and infusion rates. This is really the perfect tool to help students master the math they'll rely on in clinical settings. So again, the curriculum includes 7 lessons. It starts with those key math concepts, fractions, decimals, ratios, percentages, We've heard from teachers that they often need to revisit these basic concepts in class before they can even start talking about medical math. So we made sure to include lessons that do exactly that. They cover the basics. Then the lessons dive into those healthcare specific skills like oral medication calculations, pediatric dosages, infusion rates, etc. Like our medical terminology class kit, this is also designed for flexible teaching. You can lead the lessons in the classroom, or students can learn independently at their own pace through online modules. Plus, each participant gets a workbook to practice, reinforce those equations they're learning, and even take it with them if they want for future reference. Here's an example of a student activity from the first lesson. You can see it provides step-by-step instructions to build confidence before moving on to assessments. What I think is great about this program is that it assumes no prior knowledge. It puts all students on an even playing field before diving into those important medical math concepts. Now, you do have flexibility in how you integrate this program. The curriculum is available in both physical and online formats with identical content. This allows you to decide what your students complete independently versus what you cover in class. For example, foundational lessons can be assigned as homework, or you can use class time to address gaps in those basic math skills. If you're at all interested in trying this kit, we encourage you to visit our website. There's a URL on your screen right now. You can actually try the online lessons for free. Couple of quick clicks, give us a little bit of information, and then you can access a full lesson from the curriculum, plus the teacher guide and other resources, so you can really get a good taste of what comes with this kit. Next, we're going to explore our healthcare interpersonal skills program. This program combines physical and online curriculum components with 10 sets of scenario cards, all designed to spark meaningful discussions and skill building opportunities focused specifically on healthcare interpersonal skills. We think those skills are essential for every healthcare career, no matter the specialty. And this program is designed to equip students to communicate effectively and compassionately in real world situations. So, we talked a little bit earlier in today's presentation about how today's students need to see the relevancy of what they're learning and how it applies to the real world. This program does exactly that. Our healthcare interpersonal skills program is really two programs in one. The first 10 topics, which are listed on your screen, are covered in the spiral bound curriculum and student workbooks. But the final topic, empathy, is a little special. It gets additional attention with 8 dedicated lessons online. So we just said how important healthcare and interpersonal skills in general are for anyone going into a healthcare career. But empathy, truly empathy, we believe is one of the most vital skills for anyone providing direct patient care. And so investing extra time in this area, if you're able, helps develop those compassionate caregivers, the kind we all want looking after us and our loved ones. Here's an example of a scenario card that it comes with the program. These versatile cards are perfect for small group discussions, large group discussions, icebreakers, writing assignments, you name it. You can even introduce one soft skill a week, seamlessly just layering those lessons into your existing course content to reinforce learning over time. Now, let's explore our ethical and legal issues in healthcare program. So this comprehensive resource equips students with a strong foundation to understand and navigate the complex ethical and legal challenges that they'll face in real healthcare settings. Like our healthcare interpersonal skills program, this program offers real-world scenarios and therefore critical discussion opportunities, helping students develop the confidence and judgment they'll need to make sound decisions in their future careers. Here are the 10 lesson topics covered in this curriculum. These topics are rich and thought-provoking, really designed to spark meaningful conversations that students might never have anticipated, whether with patients, families, or fellow healthcare professionals. And as your students explore these issues, they'll start to realize just how crucial this knowledge is and how profoundly it will shape their decisions and actions in real-world healthcare situations. So here's another example of an assessment that's included in one of the topics in the curriculum. This is actually from the first lesson, legal responsibilities and implications, excuse me. These post assessments give you great insight into understanding which topics the students really understood well and which topics might need a little more time and attention. And they're included throughout the program so you can really gauge your students every step of the way. Like our other products with scenario cards, these can be integrated into your classroom in a variety of ways. They provide students with a valuable opportunity to practice expressing themselves professionally and confidently. And since these topics often inspire diverse opinions, this is also a really good opportunity to give your students a safe space to navigate and respond to challenging situations that's truly invaluable for their growth. Here's another great one. This is our soft skills program for caring for patients with intellectual disabilities, mental illness, or PTSD. Long name, big impact. This program offers students invaluable exposure to real life situations that can be really challenging, especially if they haven't encountered them before. This program uses an MP3 player to help students experience audio tracks that simulate dementia symptoms and auditory hallucinations. This immersive experience that you can create using these tools really is designed to foster deeper empathy and understanding for patients with these conditions. And more importantly, they encourage students to think critically about how to adapt their care approaches to meet the unique needs of this community. These are really powerful experiences that you're creating, and they're going to leave a lasting impact on your students that really prepare them for compassionate, patient-centered care. So the curriculum includes a variety of topics from simply defining intellectual disabilities and mental illness to strategies for working with patients who are experiencing these things. They're rich and thought-provoking topics. Again, like the other programs we've just talked about, really designed to help students start to think about concepts that they might never have experienced or had exposure to before. And again, giving them that safe space to discuss it with their peers, to be honest with their classmates, to ask questions, to share concerns. Again, preparing them to really provide compassionate patient care in the real world in the future. So here's an example of a summative activity for students to complete at the end of a lesson. This particular activity presents lifelike scenarios that aren't black and white, reflecting the real challenges students face in the workforce. We really think that by working through these situations, and again, having that safe space to discuss different approaches is essential for building critical thinking and professional growth. So you've probably noticed a theme here, scenario cards. These are incredibly versatile and they're in a lot of our different healthcare programs for a reason because they can be used in so many different ways to complement the topics at hand. You can use them in small group discussions, think, pair, share, large group discussions, even role-playing activities, giving students a chance to apply what they're learning in those real-world situations right away. And then again, this program also comes with those accompanying workbooks, which provide a really great space for pre-briefing, debriefing, note-taking, and reflection, and again, are something that the students can walk away with and keep their notes in the future. All right, so pivoting a little to a more directly hands-on tool, our AED trainer. This trainer is a safe, hands-on way for students to learn a foundational life-saving procedure without the risk of delivering an actual shock. With the pre-programmed scenarios, goodness, students can practice the essential psychomotor skills needed to respond confidently and effectively in emergency situations and really develop that muscle memory. This trainer supports both adult and pediatric scenarios, giving students that opportunity for comprehensive practice. And there's a lesson in the product titled Cardiac Arrest Management and AED, which is really designed to reinforce that critical knowledge and skills. Here's a glance at a post-test for this lesson of the curriculum. This portion of content is very easily integrated into your existing curriculum as it unites the use of CPR, a bag valve mask, and emergency airways. Next is our BVM ventilation trainer. This is an awesome tool for teaching students how to deliver effective rescue breaths using a mask. This trainer provides that immediate feedback on both the volume of air delivered and the rate of breaths, helping students refine their technique in real time, right? That instant feedback today's students are looking for. Plus, it offers independent practice. Students can practice independently and really build the confidence and competence they'll need to perform this critical emergency skill with confidence. Our BVM trainer does come with a set of curriculum as well. This gives students the opportunity to practice in realistic scenarios, gives them experience thinking through how they might manage nerves and adrenaline, as well as the actual skill, so that when the real emergency occurs, they can rely on the muscle memory, but also the knowledge they've gained through these lessons to really develop to really develop and offer that competent, accurate care. Next is our infant health and safety pack. This pack includes two realistic babies, our choking baby and our infant CPR mannequin. Plus, you get a variety of teaching resources, 27 scenario cards, a comprehensive curriculum, student workbooks, and two posters. Perfect for both teaching and decorating your classroom. Now, the curriculum that accompanies these two babies is divided into two focus topics, airway obstruction and emergency infant CPR. It introduces over 50 first aid procedures and scenarios specifically designed for infants and toddlers. It walks you through small group projects, paired activities, and independent work, giving students plenty of opportunities to learn to recognize safety hazards, apply proper safety measures, and perform essential first aid techniques tailored to young children. And of course, those lessons seamlessly integrate the two babies, the choking baby and the infant CPR mannequin, so that students get plenty of hands-on practice right alongside those lessons. This is a really cool curriculum. It was developed by subject matter experts and curriculum specialists, and it includes clear lesson objectives. You get the required materials list. We offer class time estimates, answer keys, etc. All the resources you need to cover these vital foundational topics. In fact, here's an example of an assessment that is a skills checkoff. So you can see there's a great amount of detail and information. So students and you as the teacher both know what's being assessed. This removes the mystery involved with skills evaluations and can help ease your students' anxiety because they know exactly what's being looked for. So these last three products, the AED trainer, the BVM ventilation trainer, and that infant health and safety pack, these are all excellent additions to any emergency response coursework. One effective way to use them is by setting up stations in your classroom, allowing students to rotate through each trainer. You can encourage students to practice their skills and provide constructive feedback to their peers using those accompanying skills checkoff sheets. Really creating that hands-on, peer-supported approach and help your students build confidence and reinforce those critical emergency techniques. All right, last one. Our final product today that we're going to talk about is our blood pressure simulator. This is an invaluable tool for practicing accurate blood pressure measurement. This simulator can be used on standardized patients. It can be used on mannequins. It can even be used safely on students. And that's really the key here. Because unlike traditional cuffs, which can limit practice due to arm discomfort from repeated inflation, this simulator features a specially designed cuff that does not actually inflate, allowing unlimited practice without discomfort. And in fact, with the touch of a button, the electronics box provides instant feedback, helping students verify their readings. Plus, an on-screen indicator guides students on whether they're releasing the cuff's air too quickly, too slowly, or just right, giving them that instant feedback that they crave, but also ensuring they can correct themselves in real time and really master the proper techniques. Our blood pressure curriculum is designed for high school and post-secondary health occupation students or CNA assistant training courses. It takes about 1 to 1.5 hours to complete, but can be adapted for longer sessions using supplemental materials. And really, the main goal is to teach students how to accurately measure blood pressure and interpret the results following the American Heart Association guidelines. So, like our other curriculum, the lesson begins with pre-activities, in this case, a review of arterial anatomy and an empathy exercise. And then concludes with hands-on opportunities, reinforcement of those foundational skills, and then actual practicing that proper procedure for taking blood pressure and how to document their findings properly. And then it concludes with a brief quiz to assess student understanding. So you've noticed a pattern here, we're hoping. All of our tools come with comprehensive curriculum, and really we consider our curriculum a hidden gem of our training tools, if you will. It's all very detailed. It lays out the resources that you'll need, the teaching time, the lesson topics, so you are easily able to implement the entire thing at once or pick and choose lessons as they apply to your specific program. Okay, that concludes the foundational health science teaching tools that we wanted to cover today. So I did want to conclude with some great free resources. We offer a ton of information on our website. It is a really a wealth of activities and information, as well as very cool tools. A few highlights that we wanted to share with you today is a free poster. In fact, one of over 40 free posters we offer on our website. This particular one addresses healthcare soft skills. You can go onto our website, download and print this poster, hang it in your classroom, and use it to jumpstart all sorts of fun conversations on the soft skills that are particularly valuable to healthcare careers. We also have a ton of free guides on our website. My favorite is one titled Teaching Empathy Toward Older Adults. This offers a wealth of information on lessons, activities, and ideas you can use to get your students thinking about the importance of empathy and specifically geriatric sensitivity if you feel that that might apply to them as they move on with their careers in the real world. Of course, you can see all of the tools that we offered today, that we covered today, plus a few more by visiting our website. And as always, if you have questions about the tools, how to use them, or anything we've discussed today, please feel free to reach out. You can email us, call us, or live chat directly on our website. You can also scan this QR code here or click the link that we're going to share in the chat. That will connect you right with your local Realityworks account manager. They'd love to help you answer questions, provide a free quote, have a chat about your unique program needs, and more. So with that, we'll go ahead and conclude today's presentation and answer any questions that may have popped up during the presentation. Em, have you seen any?
Emily, one that just came in was that someone thought that we were going to cover how to integrate the new Real Care babies with the old Real Care babies. Do you want to go over when that webinar is?
Yes. Oh my goodness. An unrelated but fabulous question. As some of you might know, we just recently launched our new Real Care Baby 4, and I'm so sorry about the mix-up. We do have a webinar coming up just next month on teaching a blended program. And in fact, if you want to just share your, can we see the name in the chat, Em? Because I think it might be easiest. We can also follow up with an email to you specifically just to make sure you know exactly where to go to reserve your spot for that webinar. But that is next month, and it will absolutely cover teaching with Real Care Baby 3 and Real Care Baby 4. Our product manager, Denise, is super excited to present some really great content. So, Em, do we have contact info for that individual?
We do.
Okay, awesome. So please keep an eye on your inbox. Delighted you asked that question. We will follow up with some more information.
Awesome. And then another question that came up is how are they going to access your PowerPoint? Do you want to review that one more time?
Oh, also a good question. So I know in the beginning I shared some cool stats in that chart, and then of course all sorts of links throughout this presentation. So we will be sending an email to everyone here today within the next 24 hours. So really pretty quick. Keep an eye on your inbox. You will receive a link to this recording, a link to my slides, and a link to your certificate of completion for those of you who find those helpful to showcase the time you spent with us today.
Awesome, Emily. And then one last question that came in is how and where do I find pricing? I'm guessing they meant how do I order and where do they find pricing?
Ooh, yes, absolutely. One of my favorite questions. You can visit our website. Every single tool that we offer is available for purchase right on our online store, or you can request a personalized quote if that's, if you need a little more paper to maybe present to an administrator or, program director. We can absolutely provide you with a personalized quote and other information as well. So whatever you need, our website's a great resource. In fact, I can share a link right in the chat of this presentation, and that way everyone knows exactly where to go. And here, I'll share that now. And That will take you right, this link will take you right to our health science category of our website. From there, you can use, there's a really cool little filter option on the left-hand side of the screen that you can use to get right to foundational tools or any other category of tools you might be on the lookout for. And then prices are all right there on the website.
Awesome. And I'm not seeing any additional questions coming in at this time.
Okay, great. Well, thank you everyone again for spending some time with us today. Feel free to again reach out if you have any questions or concerns. And again, keep an eye on your inbox. Everyone will receive that follow-up email within 24 hours, linking again to the recording, my slides, and your certificate of completion. Thanks again.
Thank you so much, everyone. Have a great rest of your day.